Hello, my name is Fletcher. I'm one of the plastic surgeons at Plastic Surgery Northwest. Today I'll be answering a three-part question posted to our Northwest Breast Center website. The first question asks, how we monitor DIEP free flaps during a person's hospital stay. In general, we use three basic approaches. One is a visual inspection where we assess the exposed abdominal skin to confirm that the artery and the vein are both working properly and in a balanced fashion. A second method of free flap monitoring is to use a Doppler probe. There are several Doppler probe types. In general, we tend to use the external probes where we listen to vessels that we can identify in the skin of the abdominal tissue and listen to the artery, the vein, or both to assess the quality of flow within those vessels. A third option is to use what's called Vioptics, which assesses the oxygen saturation at the level of the patient's free flap skin. Those three techniques enable us to identify problems with venous or arterial flow to a person's newly reconstructed breast. The next question I would like to answer asks, what percentage of patients who go through DIEP or deep flap breast reconstruction experience a failure? At Plastic Surgery Northwest, our deep flap failure rate is between 0.5 and 1%. That is to say, 99 to 99.5% of the time, a person who goes through free flap-based breast reconstruction is successful in keeping their tissue alive and healthy. The last question I would like to answer for you today asks, for those women who undergo deep flap breast reconstruction and experience a failure, what their options are in terms of future breast reconstruction. The most common strategy we use in the short term after a person loses their DIEP or deep flap breast reconstruction is what's called a tissue expander. A tissue expander is an adjustable implant that enables us to control implant-based stress on their breast skin after mastectomy. The reason we tend to use tissue expanders after a free flap failure is that they allow us to quickly and easily support the patient's breast skin while we perform an investigation to determine why they lost their breast in the first place.